And so you can see from these pictures here that the shoulder moves in a lot of different planes. Again, it's the most mobile joint in the body. Okay, so it's going to come all the way across like this. You run to an obstacle where you can't move across your body like that, and then you come over here, and then you can move farther back here. So you can see with these different restrictions of the motion there. All right, so now's where we can use our props. And this time I have a more authentic oriental sword rather than my other swords here. Okay? So a lot of the times shoulder motions, range of motion are going to be combined motions. Like when I do this, okay, what motions did I do? Okay, I'm moving across the body like this, right? What is that? Abduction. Okay, I'm doing forward elevation, and then what kind of rotation is that? External rotation. Sometimes you get confused with, okay, what's inside but out, but if you have a sword like this, it's a lot easier to tell. Okay, that's external rotation, that's internal rotation. So then I move out into this position like this, there's external rotation, there's internal rotation. Okay? And then what's this? Well, what are we doing with the scapula? Right? It's protraction and retraction. Right? But yeah, it is kind of a line. Okay? And then we'll talk about other things. Now basically here's going to be forward flexion or forward elevation. Okay? And then this is extension back here. Okay? And then this is horizontal, this is abduction. Okay? And this is adduction, going across like that. Okay? So then again, here's going to be internal rotation, here's external rotation. Okay, and then what would you say that this is here? So the arm's raising up, so we could call that elevation, but what plane is it in? I'll give you a hint. It's this right here. The scapula, right? So it's forward elevation in the plane of the scapula. And then this would be forward elevation in the plane of the humeral joint. Okay, so if I'm going this way, that's different than this, but then you can have other combined motions like this. Okay, that's where we're getting into, what's this here? Pronation supination, right? Where does that happen? At the elbow joint, right? So when you're talking about pronation supination and external and internal rotation of the shoulder, that's where you're getting all this more of a combined movement like this. Okay? All right, so we'll put this away for now. So we've got enough swords, maybe at the break we might be having a little sword fighting battle. All right, so then now we'll talk about the ligaments. And then again here, this is that same picture looking down where it shows the plane of the scapula. And then here's the glenoid labrum, which is here. And then these ligaments here, what they are is actually thickenings of the joint capsule. The joint capsule goes all the way around it, but then there's thickenings of that. They talk about that as a superior, middle, anterior, and anterior inferior. When you have, again, like talking about the scapulohumeral rhythm, when you're moving the shoulder like that, there's a lot of movement that occurs if the scapula combines with the shoulder. So then you have the acromioclavicular ligaments. So there's a couple of them here. You have the corticoclavicular ligament here. And that's going to be the strongest one right there. That's the one that holds the AC joint together, holds it in place right here. And then you have the acromioclavicular joint capsule, which is going to be right here. Okay, and that's this part right here. Okay, that capsule holds the joint together, but what really stabilizes it more is the one that comes off the coracoid process. So the coracoclavicular is a stronger ligament of the AC joint. And then what's this ligament right here? Usually you name ligaments from the two places that they attach, right? What's this? And then what's that? Acromion. So this would be coracoacromial ligament. And that's what you kind of almost refer to as the roof of the shoulder joint. That's like the top. That's where the humerus is pressing up like that. That coracoacromial ligament is what's the top of that, the roof of that shoulder joint there. And then what's going to be right here? Sternoclavicular, right. So this coracoclavicular ligament has two different parts of it, but you don't really need to worry about that. Just know that there's the coracoacromial ligament, and that's one that holds the AC joint together the most. And then you can have some ligaments at the sternoclavicular joint, which basically is holding this in right here. And then here again, we're talking about the scapulothoracic joint. That's just a repeat of what we were talking about before. So then you can have different bursa in the shoulder. Probably the one that's most important that we'll be talking about clinically is this subacromial. So here's the acromion, so subacromial is going to be right below the acromion. That's what's going to get impinged when we're talking about that suprahumeral joint. Okay, that's what gets impinged along with the supraspinatus tendon. We'll talk more about that. So this is a special type of an X-ray. It's a bursogram where they inject something into the bursa and then it's going to show up on an X-ray. So then we're getting into the contractile tissues. Okay, all these muscles are listed in the notes. I'm not going to go through all of them, except we will spend a little more time on the rotator cuff. So everybody know what the muscles of the rotator cuff is? Yeah, it's usually, in mnemonics, usually SITS, right? Okay. So you have the supraspinatus, and that's the one that's going to be at the top. That's the one that goes through this subacromial space here. Okay. Then you have infraspinatus and the teres minor. Those are on the backside, and those are external rotators. And then you have the subscapularis on the anterior part, and that's going to be an internal rotator. But again, the primary function of these is not the internal and external rotation and elevation. It's more to hold the humerus in place and stabilize the shoulder joint. So then you can review these. Basically, there's muscles that stabilize the shoulder on the front. You're going to have the pec major, pec minor. On the back, you're going to have the traps. And then over this, you have the deltoid, also the latissimus and rhomboids play a part in all that too. And you have the biceps. And we'll be talking about this one. The name biceps, right, it's talking about there's two different parts of it. So there's a short head and a long head. So the short head goes here, and then the long head goes all the way across into the glenoid area. And other muscles, you have the teres major, deltoid, pec minor, pec major, latissimus,